My name is Rohit Bhargava. I'm a professor of bioengineering and I direct the Cancer Center on our campus. My work involves a field that we call chemical imaging, and the idea is to measure the chemistry of materials. In particular, my lab focuses on measuring the chemistry of tissue with a view to diagnosing cancer better than we can do today. Basic science is the exploration of ideas, so you're really focused on discoveries. And that is the bedrock of all scientific progress and all technology. At some point, every technology was basic science. So your iPhone was physics at some point. And our understanding of physics leads us to make components, for example, transistors, that leads us to make circuits, that leads us to the iPhone. So basic science is really the bedrock of everything we do in society today. Two reasons. One, it is really important to explore the origins of cancer and understand how cancer develops. So that's a very basic science view of cancer. We always also keep an eye on how that basic science will be translated to human benefit. So for example, we want to focus on understanding the mechanisms that drive cancer, and then go to our chemists and say, can we build a molecule that prevents those mechanisms from occurring? So this bridge between basic science, understanding, as well as making use of it, is something we can uniquely do on this campus. And that's why we're focusing from the ground up. We're very different from other cancer centers in multiple ways. The first is our focus on basic science and engineering. In engineering, you start from basic science, but then you have to take multiple steps to develop a particular technology. And at every step, you have to make a design choice. So by having expertise, the large expertise we have on this campus, focus on cancer from the basic discovery up until the development of a technology or a therapeutic, we can effectively make those design choices that lead us to better solutions. Second, we are developing technology that was just unimaginable just a few years ago. For example, we're developing a technique which can detect very sensitively biomarkers in blood in just 30 minutes. So imagine going to a primary care physician's office tomorrow, taking a small rinse, an oral rinse, and putting it into this machine, and 30 minutes later, assessing your risk for developing oral cancer. So both in our way we're doing things and in the technologies that we're engendering, we're really unique in the nation. The Cancer Center at Illinois is focused on two main areas. One is better detection and diagnosis of cancer, and the second is better therapeutics. So in the first one, we look at the whole continuum. Obviously, we all know that early detection is the key to better cures. So there's a segment of our researchers who are focused on early detection. Once there is a suspicion of cancer, we have to find it. So a second group of our researchers are focused on imaging technologies that can go and locate cancer. Once we've located cancer, we want to understand its chemical makeup and how it might progress. So there's a third group of researchers who are focused on understanding the composition of cancer at the cellular scale and perhaps at the molecular scale, and then using that information, using artificial intelligence and computational models to try and predict what will happen and perhaps what might be the best therapy for that individual patient. So our approach, among other approaches, is to take drugs that we develop with our expertise in chemistry, translate them over to our veterinary medicine, prove the concept in pet cats and dogs, and translate the exact same medicine to humans. Because the same spontaneous tumors that occur in our cats and dogs also occur in humans. Also, we're making engineered tumor models in the lab. So imagine a model of a person's tumor being grown with our material science expertise in the lab, and actually many, many copies of it. So we can take the drugs, new drugs that we develop, test them in the lab with many, many copies of a single patient's tumor, and then we can actually give the best advice and the best therapy for each and every individual patient. That's our goal at the end of the day. In today's funding climate, it is really difficult to do basic research with a threat of a cut to support basic science. And I understand why there's a thought process behind cutting basic science. The reason is it's really difficult to extrapolate from a basic discovery to benefits. Whether we realize it or not, everything around us was once basic science. And the United States has really been a leader in basic science over the last few decades. That has led to an amazing quality of life in the United States, attracted great financial returns for the US, and attracted the world's best and brightest to the country. So basic science is not just something that helps you make better technology. It actually helps you make better societies. And if we focus on basic science in particular in those areas that actually help the health of society, like cancer, I think we're arguably better off in the coming years.